Thank you so much for being here and welcome. Welcome to our wellness webinar. Our topic this month is Movement is Medicine, Managing Peripheral Neuropathy. And my name is Anne. I'm the IWMF's Wellness Program Coordinator, but I also teach a lot of our mind-body classes, and I get a lot of firsthand experience learning what it's like to live with Waldenstrom's. And one of the most talked about symptoms is peripheral neuropathy, which may be a result of the WM itself. It might be from WM treatment or something else. Nevertheless, many of you describe this as truly debilitating. Truly, truly debilitating. So I'm really happy that we're able to provide some help for you. Today we're going to be learning all about PN, peripheral neuropathy, and how movement and exercise can help manage symptoms. While everyone's PN is different and damaged nerves may not be able to recover, research that Nancy, our guest, shared with me shows that an exercise regimen that incorporates strength and balance training may help improve symptoms. So we're also going to be doing some exercises to help improve balance, help with grip strength. And at the end, you'll have a chance to ask our esteemed guest questions. And I want to just remind you to confine the questions to topics surrounding movement and exercise, and try to steer clear of those questions like pickle juice and quinine and medications, because we're talking to a clinical exercise physiologist. So that also brings me to my disclaimer. Our complementary and integrative practices that we share through the IWMF are to be used in conjunction with standard medical treatment along with the approval of your doctor. So just a quick thank you for all of you finding your way here, and to the IWMF staff who is also here to help manage our large group. We're going to stay muted during the session except for Nancy. And then we'll have a question and answer period. You can type your questions into the chat at any time, and I'm going to do my best to save them for the end and funnel them to Nancy. And then after we stop recording, you'll have an opportunity if you want to directly ask her a question on camera. We won't be recording at that point. So without further ado, let's introduce Nancy Campbell. She has been with us before. I'm so thrilled you're back, Nancy. I learned so much from one of your webinars you did previously. Nancy is a clinical exercise physiologist, and she works in the Zachem Center for Integrative Therapies and Healthy Living at Dana-Farber Cancer Institute. Nancy has been a part of 15 research studies that have looked at the benefits of exercise and healthy living for cancer survivors. And that word survivors, sometimes Waldenstrom's folks don't really like to use that word, because many of us are going to live the rest of our lives for decades with, without curing it. So I want to call our group Cancer Thrivers. We're thriving with this, Cancer Thrivers. Nancy has been at Dana-Farber since 2015. She's a certified ACE personal trainer and has the American College of Sports Medicine Cancer Exercise Trainer certification. So thank you so much for returning to our group, Nancy. I'm going to let you just take it away and ask straight out of the gate, is there anything we need to participate in this webinar?
I would say the only thing you might need, or I think most of you are probably sitting in a chair, but you're going to potentially need a chair that's not on wheels, which the one I'm on currently doesn't qualify. And possibly if you have a tennis ball or a pinky ball, but again, or in my case, purple, which I'm sure shocks anybody if they see the wall behind me, that would be my favorite color. So everything I own is in like some shade of purple. But neither of those things are necessary. So again, I want to say a huge thank you to Anne and Shelley and the organizers here. It was literally almost exactly 2 years ago we were together. It was January 26th of 2022. I had to go back and look, and I was like, wow, it's been almost exactly 2 years. So I am very excited to be back. So thank you all for taking time. I was going to say on this Thursday afternoon, but I'm realizing that In some cases, it's Thursday evening or Thursday morning, or so whatever it is. I appreciate you all spending some time with me. So I'm going to share my screen. So, an agenda. I feel like this agenda is more for me than anybody else. But here's sort of what the goal is today. So, little introduction. What is peripheral neuropathy? You all could probably do this part better than me. How exercise may help with your symptoms. We're going to do, as Anne mentioned, we're going to be doing some stuff together. We're going to be practicing some stuff and then doing some questions. So, again, what is it? So, I'm going to go relatively quickly over these things because, again, you all are by far the experts with this. So we can focus more time on the exercise, but just to, cover our bases here. A group of neuromuscular symptoms that result from nerve damage. Now, I think for probably the vast majority of you, it's from the actual diagnosis. But some of you, it might have been from some chemotherapy. So there are certain ones. And then in other cases, it's diabetes. And then, there's a percentage of people that have what they call idiopathic, meaning we have no idea why this is happening. And I'll say from the CIPN perspective, the data really ranges 30 to 90% of folks who get these specific chemotherapy drugs will, wind up with CIPN. And those are listed below. And, as you may know, at least from the CIPN perspective, sometimes those symptoms just last for a short period of time, but other folks, this is a more chronic thing. And that's, likely what we're discussing more today. So again, symptoms. They're going to vary, even though, everyone here today, is likely struggling from this. There's going to be, it's going to look different for each of you. Certainly, even from the diagnosis, but again, if it's from treatment, other individual differences. Largely, sensory nerves wind up being affected. So, the numbness, tingling, again, mostly, sort of hands and feet, but not that it can't, kind of travel. And at least this time of year in the Northeast, sort of even harder with the sensitivity to cold or touch. Then we have motor nerves. So things like trying to button, small little buttons, open jars, things like that. Gait patterns. So we're going to talk, a bit about the foot piece of that. And of course, this often leads to, sort of slower walking speeds, shorter steps. And again, we're going to talk through kind of how to address those pieces. And then lastly, the other nerves that can be affected are our autonomic nerves. So involuntary things like controlling your blood pressure, your internal body temperature, your bladder, things like that. Okay. So we're going to start with some like really general tips for foot neuropathy. So things, if you have some numbness in your feet, you should try to find comfortable, properly fitting shoes. Now, this can sometimes be easier said than done. I do feel like the shoe market has, sort of expanded, literally in the size of their shoes, and kind of makeup of them, but just in the variety that is out there. But that, being, a really important component of, helping with the foot neuropathy. The general recommendation that's out there is to avoid sandals, open-toed shoes, flip-flops, high-heeled shoes. But I'm not going to lie and say I don't meet people who are like literally the only pair of shoes that I can comfortably wear are, a lot of times people might be able to get a pair of like Keen sandals or something that at least it has some openings around the foot, but like the toes are still kind of covered and it is, it's not a flip flop. But again, I know a lot of times we have to get creative and find a happy medium here, with footwear that is, again, comfortable, but also sort of properly fitting. And then important, if your feet are numb, that you take a peek at them every day. And in some cases, it's asking someone to help you with that. Because sometimes being able to actually look at the bottom of your foot can be challenging. So, and you would imagine if your feet are numb, you might not have realized that there was, you were out on a walk and a little rock wedged itself in there and you didn't feel it, but it had, worn away, or maybe a blister. So, really trying to stay on top of, that inspection process to make sure that nothing is going on. And if there is, we can get ahead of it. And again, the general recommendation is sort of avoiding, walking barefoot, or certainly in socks alone. Although I do feel like now there's so many socks on the market, call them yoga socks or like surgical socks that you get at the hospital that have those grippy bottoms, that are at least, give you some, protection, or if like you're, getting up, in the middle of the night or something. But in general, that is the recommendation. And then of course, checking your shoes, before you put them on to make sure someone, it's a critter or a, other thing hasn't wound up, a random marble or Lego piece from a child or grandchild or whatever hasn't wound up in there. So just take a quick little shake of your shoe to check on that. And this is a tip really, for a lot of people who are on their feet all day. This is a trick that a lot of nurses use who are on their feet all day, is changing their shoes in the middle of the day. Some people find that to be a helpful way, when they're having foot discomfort. And then, a sort of continued theme that will come up, through this entire presentation is pursuing, physical therapy, occupational therapy, podiatry. These folks, can be immensely helpful in this process. I'm sure some of you have already pursued this. So we will, bring this up again. So now we'll transition to upper body into hands. So of course we want, particularly in the colder weather, making sure that you are, dressed in layers, protecting your hands, and keeping in mind too, I don't need to tell you this, but like when you're reaching in the refrigerator or the freezer, I have people that literally just leave a set of, winter gloves just sitting on the counter so that when they have to reach into the fridge, that they have, something sort of ready to go right there. So that can be helpful. And then, being mindful when you are washing dishes, taking a bath or a shower, that, that water is not too hot, because if you, aren't able to sense those things, we want to make sure that we don't, wind up getting a burn from some of this. Pot holders, never, safety first for sure. Um, Gloves, when you're washing dishes, when you're gardening, things that might, potentially put you at risk for, getting a cut, or a scrape, or again, being exposed to sort of higher temperatures. And like the foot, looking, inspecting between your fingers, every day to just make sure, especially sort of the colder times of year where, the skin can get really dry and cracked. So, lots of, good emollient, lotions and things this time of year to keep those hands, from getting chapped and dried out. And we're back again. An appointment, PT or OT, very, very helpful. Okay. So we're going to transition to kind of talking about some of the research. Now, I had gone back to the previous presentation I did 2 years ago, and I'm like, okay, there's going to be like so much more research and like so much more I can present about. And I was like, oh gosh, it's still get to this. Most of the research that's out there is still existing in the diabetic neuropathy, or still the CIPN version is where the vast majority of this research still is. And I wouldn't say that that doesn't make it relevant, and that potentially the things that work for DN or CIPN won't work for PN. But just kind of knowing and having that caveat there. So there was a 2023 meta-analysis that was done. And I think when I presented 2 years ago, there had been a meta-analysis done. So, this got updated, 9 systemic reviews, 10 randomized control trials. And then you can imagine within this research, the exercise modalities, some of them were just cardio exercise, some of them were strength training, some of them were strength and balance, some of them were yoga. So then it makes it hard because, well, how do you, compare and contrast the different modalities? So the conclusion here was that unfortunately their conclusion is there's insufficient evidence to judge sort of the effects of exercise. And again, this was mostly on CIPN, just from the lack of really like what are called phase 3 studies. So, kind of larger studies. And so again, the heterogeneity of the population, the different exercise interventions, the different ways they measured outcomes. So, I will say that I was a little bit bummed that we didn't kind of make significant strides. But what I'll say is that doesn't mean, there's nothing that we can do. Like, we don't have research that shows lots of like sort of inherently obvious things. So, but I did want to at least do a check and make sure that maybe something hadn't come out. But that, at least from this very large meta-analysis, was their conclusion. So we'll, sort of think now at this point a bit about the benefits of exercise. I don't probably need to tell you all that, everybody knows exercise is important. But we'll sort of look at it more through the lens of PN. So some of the issues that often come up, when you have numbness, tingling, is what they refer to as reduced proprioception. So it's the ability, like when you're standing, the ability to know sort of where you are in space. And when you don't have that sense, it can make things like walking really hard. You can't feel your feet to know, how you're walking. So you may notice that you don't always walk in a straight line because you don't always have a sense of where you are. And so you're, people tell me they're like bumping into walls, or they're walking next to someone and they, jostle them because they're not always the best at sort of being able to sense where their foot is and where their body is in space. Again, that decreased, sensation, fingers or toes, feet. And then this ultimately leads to a reduced strength in that area. And so that's something that, relatively speaking, we have control over. These are things that, we'll work on together today, that will hopefully help some of these sensations. So all of this, of course, leads, can lead to an increased risk of falls. And, never mind right now, again, being in the Northeast in Boston, being outside recently has been treacherous enough, without neuropathy, to go out for walks. So, given all of these layered pieces here, exercise being very important. Okay, so Working on strength and balance is going to help us improve the symptoms that we just went over on the last slide. The other things that I, really sort of spend the most time thinking about is maintaining and increasing your strength and muscle mass. There's never anyone, like on their deathbed, for lack of a better term, who's like, gosh, I really wish I wasn't so strong. Like, no one ever says, like, I wish I were a little bit weaker. I wish I didn't have all this muscle mass that I had to carry around. Like, strength will always be your friend. um, and then maintaining or increasing your bone mass, because as we all get older, maintaining our bone mass is challenging. And then if we are throwing things like steroids, other chemotherapies in the mix, bone mass, can be affected. So when we're focusing on strength and balance, we're going to be helping with that. Improving quality of life. Who doesn't want to be improving their quality of life? Decreasing inflammation. I mean, this I feel like is a big buzzword and buzz term, and you hear about this and on social media and things, but there's some validity to a lot of this. And if we can be kind of bringing down our overall inflammation in our body, yeah, I'm not going to claim it's going to cure your neuropathy, but if we can, help the overall inflammation in your body, that may help, kind of mitigate some of those symptoms. And then, the strength and the balance, if you are on other, treatment, whether it's, cancer treatment or, things for diabetes or things for heart disease or things like that, helping you tolerate side effects from those medications. And then sort of specifically what we see with the aerobic exercise. So if we think about things like walking, riding a bike, some of the reasons they're so helpful is because they help stimulate the circulation. And then as we get that circulation going, it's delivering more oxygen and nutrients, particularly down to the extremities, which is what we often need. So that is one of the reasons, that we postulate and see where the walking and things that get the heart rate up and get the blood flowing are helpful. Okay, so if we kind of take a step back and we think about sort of what should your weekly exercise prescription look like. So we've kind of stolen this in the exercise world, like one of the phrases you might hear is something like exercise is medicine. So with that phrasing, then we think about, having an exercise prescription. So, how much exercise should you be doing a week? What's the recommendation? Where does the research lie? So the first component of an exercise prescription is the cardio piece. Now, the research shows us that a weekly goal of 150 minutes a week has lots of benefit. Now, for a lot of you, might want to like reach through the screen and punch me in the face. Like 150 minutes, Dance? Like, I'm sorry, what? Like, I A, don't have the time, or B, I don't have the energy. And so knowing it can be broken into, 10-minute chunks. This doesn't need to be 30 uninterrupted minutes, an hour, uninterrupted. Like grabbing, I like to call them exercise snacks, like grabbing these, 10-minute, increments throughout your day, and that they all over the course of the week, kind of add up and help you work towards that goal. If you are currently, exercising 0 minutes a week, 30 minutes per week, that doesn't mean that next week you need to be at 150 either. We want to slowly get you there. But I think for a lot of people, sort of having a goal and sort of knowing where the research lands and something to aim for, but then, getting yourself there, small steps. And then we think about the mode, like what kind of cardio should I be doing? Or people will ask me like, what's the best cardio? Um, and what I say to this is, sort of two things. I ideally want something that you enjoy. Sometimes I feel like I need to put enjoy in like quotes because I realize that like not everybody like gets out of bed in the morning like woohoo, I get to go walk on the treadmill. I, some of us do. I'm probably one of them. But finding something that you at least don't absolutely dread, maybe. And then something that doesn't increase your pain or symptoms. So if walking is absolutely miserable, I don't want you doing that. Can we, get a bike? Can we, maybe an elliptical feels better. Maybe you're in the pool. But sort of trying to find a marriage there between those two things of something that you enjoy slash don't dread, and then something that doesn't make your symptoms worse, or just generally make you feel worse after, even if it's not necessarily the neuropathy. If it wipes you out or something like that, then we don't want that. So the strength piece, 2 to 3 days a week is our usual recommendation. And then we want to be focusing on what we call the major muscle groups. So, your legs, your back, your chest, and your core. So literally for 2 to 3 days a week, that means you could do something for your legs. We'll go over, like you could do a squat, some kind of a squat. You could squat to your chair. You could go up to your wall and slide down your wall and do a wall sit. You could do a wall push up. You could do a rowing motion, and you could do a core exercise and be done. 4 exercises, major muscle groups, done. Are there lots of other ways you could do strength? I'm going to share some of the resources from the Zakem Center that you are able to take advantage of. I'm sure there are lots of other things potentially in your community, YouTube. But from the strength perspective, knowing that it doesn't, need to be 45 uninterrupted minutes and you have to be in a gym or you have to own this, extensive home gym. This thing here, that your body is an excellent home gym. You can get lots of resistance. And then when you don't, you grab like soup cans and water bottles and like other random, things you have around the house. I have people in my class with like shampoo bottles, like, use what you got, like no need to overcomplicate it. Then we have sort of the third piece of the prescription is the balance slash flexibility slash mobility. I know, as little as 5 minutes a day, that this again doesn't, mean, yes, obviously you can join and you can do, a 30-minute class or a 45-minute class or something like that. But, not forgetting that, these little, again, sort of snacks of like, when I brush my teeth, I do some calf raises. And then when I'm done, I stretch my calves, like not, feeling like it has to be really extensive, because the piece that I sort of care the most about is this concept of like focusing on consistency, like letting that be, the goal week to week. Like, what's the saying? Like, perfect or done is better than perfect. And I would much rather have you have weeks of 10 minutes here, 10 minutes there, 5 minutes here than like, oh, I did, a 30-minute walk on Monday. I was exhausted until Thursday. And then I did a little something and then I was exhausted. Like these little chunks where you can stay consistent. I think in the last presentation, I talked about what I call the traffic light concept. There's a video that I'll show you on the Zakem website where I talk about it as well, where essentially you kind of, come up for yourself, come up with a plan for yourself on days when you're feeling like it's a red light day. What do you do on days where you're having kind of a yellow light, medium, fatigue, things like that, of what you can do. and a green light day, so that you can stay as sort of consistent with your exercise, and then you just kind of turn the dial up when it's a green light day and you turn the dial down when it's a red light day, but that you're still sort of maintaining that sort of forward movement in terms of your exercise program. So the other piece that I like to just, sort of mention here is this kind of overarching concept of fatigue cycle, uh, what is like literally coined as cancer related fatigue. Again, you all, are the experts in this. But knowing that it is like legitimately a specific thing. And I don't need to tell you the fatigue from cancer related fatigue is very different from, college where you like pulled an all-nighter, or you had newborn baby, things like that. Like this is its very own distinct type of fatigue that is very much like a vicious cycle. So you're tired, so then you're resting, and then you're getting deconditioned, so then you're more fatigued, so you rest more, and you're like in this vicious loop of like, how can I get out of this? And that's where kind of that traffic light concept, or kind of finding these small bouts of exercise. So, related but unrelated to the neuropathy piece of this, but I would be remiss if we didn't at least hit on this for a moment. Okay, so now we're going to transition into some kind of helpful tools. I couldn't quite decide the word that I wanted to use, but I think tools was what I thought might be useful. So some things that have come on the market, like some of these things either didn't really exist or certainly weren't part of my last presentation. So in terms of foot neuropathy, they now have what they call these textured socks. And, if you can tell, the little blue nubbies that are inside of that sock, and if you can see on like the foot in the picture, you can see the impressions from that. So, there's just been more and more research on, with neuropathy, like trying to get, information essentially from the foot to the brain and the brain to the foot. So having these little nubby socks can, for some people help, kind of retrain some of that. And again, some people love these things, some people don't notice any difference at all, some people find them uncomfortable, so very much to the, trying different things, and some will work and some won't. They now sell these sort of spiky massage balls, so they're relatively soft. The picture kind of makes them look like they would be really hard, but and a lot of people will like, again, sort of that texture, and maybe they're sitting in a chair and they're rubbing their foot along the bottom of this, spiky ball, or, you could literally like kind of have it on your hand and be like, massaging on your hand. But again, this kind of texture concept, I feel like this is sort of a growing, area where there's a lot more of these things available. You can find them on Amazon, you can find them, you don't need, to go to some specialty store or know something. You can find a lot of this stuff, relatively inexpensively. So I thought those were some interesting ones. And then this concept of what they call desensitization. So, we see like a picture at the top of a person with her hand, his or her hand in a container with, there's rice in there and there's beans. So you could make dinner after. But then would be other things in there like marbles or coins or things where you get the different textures and sensations, and then you're trying to feel it. Can I find the marble? Can I find the quarter? Can I find the penny? So some people find that sort of thing helpful. Below that, you see a picture of a rock mat. And again, I feel like just in the last 2 years, these things have become, I don't know that I want to say mainstream. I realize I live in sort of a strange little world here where I would consider these things mainstream, but most people probably don't. these things are so much easier to come by. Like in the past, you probably had to go make your own. You had to go like find rocks in your yard, and now you can buy these things. I feel like, especially in with standing desks becoming much more popular, these mats are popular for that, or for people to have in front of their kitchen sink while they're doing dishes, to have this thing. And again, some people really like those different sensations, other people, not so much. So um the other thing that some people will do is, sort of be exposing their hands or feet to different textures. So, they'll often start with something very gentle. I mean, it could even be like a cotton ball or a Q-tip, and, kind of massaging their hand with that, and then going to something with a little bit more texture to it, like a toothbrush, like a soft bristle toothbrush, and kind of scrubbing gently along their hands to try to get, more sensation. And then maybe it's like, a hand towel or something that's got a little bit more texture, and, doing like different massage techniques on it, and sort of, if it's an older towel that's been washed many times, that's a little on the drier side. And then the extreme would be something like Velcro, or something that's, obviously not particularly nice to massage yourself with Velcro, but so you're much more gentle with that. But sometimes that different texture and exposure for some people is helpful, and similar sort of with your foot, mostly just depending on how easy it is for you to access your feet and how flexible your hips and such are. Although somebody could help you with this as well. And then, PTs and OTs will often use things like kinesio tape. You may have seen like in the Olympics or something. I'm trying to think of times when people, or even like athletes, you might see football players or basketball players on TV or something, and they'll have this funky looking tape on random parts of their body. Um, and so that, again, this is, a tape that's on, your skin. So again, we're getting that sensation, from your skin to your brain, and helping. So there's different, sort of taping techniques that PTs and OTs will use, nerve glides, cupping. Again, I feel like it's become much more popular. You can now like buy your own cupping set. But again, a lot of PTs will use that technique. So again, I feel like this, area has expanded, and there are more folks looking at these things, and making these things more readily accessible. Okay, so on our website at Dana-Farber, we have, some of you may have seen it, perhaps, we have a neuropathy toolkit. And I just took a picture of two of the videos in the toolkit. So I think the toolkit has about 8 different videos in it. At least 2 of them are from my colleague Rami, or Mel Rones, who I think some of you may have met several months ago. So there's some videos from Rami on there as well. I just snapshotted the 2 here, the one on hand and the one on foot. So our massage therapist gives you some techniques here, and then our yoga instructor has some more lower body focused. And, just as a slight detour off the true exercise piece, there's been a lot more research in the massage space with neuropathy, and there are now sort of protocols being designed for massage therapists to learn about massage and how to use massage to help with neuropathy. So like many things, not every massage therapist, this is likely oncology massage folks that are going to have this, potentially have this knowledge, but even all oncology massage therapists aren't, necessarily going to be trained in this. But it is an evolving field. There are, again, more protocols being written, things being studied. So I feel like if I come back in 2 years, there will be potentially some other things to report in terms of this. And then what's nice, in this 10-minute video, Bambi, our massage therapist, gives you techniques that you can do yourself. Because, of course, I mean, don't get me wrong, I'd love to go and get a massage. But a lot of times, from a cost perspective or time perspective, it's nice to be able to either be able to do these things, for yourself, or maybe have a loved one help you, particularly if, again, it's the foot. Um, because at least with your hand, to sit sort of like Bambi's sitting, she has a pillow on her lap, and, she can be doing the hand techniques, for your feet. Because often the thing with the massage techniques is that they need time. And so, if you're having to sit like cross-legged and massaging your foot for 10 minutes in this position, I don't think I could do that. I'm sure Anne could help us do some hip mobility before we tried to do these techniques. But so hopefully, these two videos alone from the toolkit might be helpful. But there's one from our acupuncturist, and again, several from Rami. So, definitely check out the toolkit if you have not seen this already, because it is, accessible to the public. Ah, yay. Okay. It's time to move. I don't know who's more excited, me or Anne, but okay. So I'm going to stop sharing my screen so that you can actually see me, although I don't know if we should spotlight me so that I'm again, it probably depends on how people are set up. Perfect. Okay. So let's go ahead and stand up. For those of you that want to join for the standing portion, let's go ahead and stand up, and whatever you might need, maybe a little gentle movement, a little stretch, whatever you need, get the blood flowing a little bit here, particularly if again you've been sitting for as long as I have today. So take a minute. So let's see, we are going to do a couple of lower body exercises, and then we're going to transition and do some upper body exercises. So this is the one where you're going to need a chair that's not on wheels, or you're going to need a wall. So I'm pretty sure we covered most people's bases here. I'm just going to get this plant out of my way because my chair is on wheels. Okay, so let me just tilt this so you can actually see my feet. Okay. So, if we can all coordinate, and now I don't have a head. It's always something. And so we're going to try to coordinate here, and we're going to try to have the chair or the wall on our left side. And so what we're going to do is we are going to, again, have your hand on the wall or chair, and you are going to just slightly shift your weight over your left leg. So that, because we're going to wind up moving your right. So we want to shift a little bit. And then what we're going to do is our right leg is very gently going to go out to the side and then back down. So you can either come all the way back down straight, or if you're up for the balance challenge, you're going to come out and then you're going to come down and you're going to hover. So you're going to get a little extra balance. You're going to come out to the side and then you're going to come down and hover. So some things to keep in mind. This standing leg, it's hard to tell with my black pants. Standing leg has a little micro bend in it. So you don't want to be locking that leg. It has a little bit of a bend. And we're going to do one more. Out and back. Now, hopefully you felt this here on this hip. This hip was lifting and lowering. But you might be saying, hey, Nance, I feel this hip. This hip was stabilizing you, so that you were both working. So now, of course, we have to switch to the other side. So I'm just going to turn this way. So now you want your chair on your right side. And again, you shift your weight into your right side. And now this left foot goes out to the side and back. And you don't need to lift your leg very high. I mean, our goal is not, if I turn back this way, to be kicking super high. We want to think about stability. So the least amount of movement that isn't this leg. So nice and slow and controlled. Could be a little baby, or you could come up a little bit higher. But trying to, again, use your chair or wall liberally. Countertops, also another one. And then we're going to do one more. Okay, so now hopefully your hips feel a little more balanced. But I think it surprises people how much this standing leg is the one that gets tired, because keeping you stable is hard. That helped us, get our hips stronger. It helped work on our balance. So now we're going to turn and either have the chair in front of you, or again, wall, countertop. This is the calf raise. So this is the one that you can do, at the kitchen sink, in the bathroom, after you brush your teeth. Okay, so we're going to stand feet are hip distance apart. So take a peek down at your feet. Make sure, particularly if you have a hard time feeling them, take a peek and make sure they're facing forward, hip distance. And again, holding on gently, we are going to come up onto our tippy toes. So come as high as you can, and then slowly down. And again, you come up as high as you comfortably can. Try to aim for straight up. Try not to come forward. And down. Okay, so we'll keep going. Now, this is going to be a big ask. But when you come up onto your toes, try to make sure that you are pushing through your big toe. Now, of course, if you have a hard time feeling your big toe, you're like, yeah, that's great, Nance. I can't actually feel that. You could even have someone stand behind you and look at your feet and make sure you're pushing through your big toe. And we're going to go ahead and do one more up and down. So one of the things that can help with that I will just sort of throw out there, is sometimes folks will have, like, shocking, purple, they'll have a, like, playground ball around the house. You could also ball up like a hand towel. And then what you would do is you would put that between your ankles, so that then when you come up, you're having to hold, squeeze onto this object. And that squeeze means you're working more of your big toe and you're not rolling off your big toe. Now, I'll say, even without neuropathy, a lot of people roll off their big toes. And that's, when people can feel their feet. So be mindful that, even if you can't and you're struggling, knowing that it's totally normal. So sometimes an assist, like a ball, like a towel, can help you to make sure you're staying pushing through your big toe. Okay, let's go ahead and we'll have a seat again. And from here, oh no, I lied. Sorry. I lie. Because of course we want to do a stretch as well, because we want to have strength in the feet, but then we also want to have length. So we'll come back to our wall. And we're going to do, probably a fairly traditional calf stretch. Many of you have probably done this. We're going to bring our left foot forward, and then we're going to bring our right foot behind us. So I'm in like a little bit of a lunge position. So my front left knee is bent, and then my hands are up a little further back. I just don't want to knock my bureau over here. So your hands are up at shoulder height. You're bending into your front knee, but then you are doing your best to push into your back heel. Press your foot down into the floor, and hopefully you're feeling that stretch along the back of your leg. And then we want to make sure we're breathing. So we're going to inhale together. And we're going to exhale out. And we have two legs, so we have to switch. So now the right leg has to come forward. The left leg has to come back. You might need to look at it. Again, even if you don't have neuropathy, look at that back foot. Make sure it's pointing forward, the ankle isn't turned, the foot isn't turned, arms up at shoulder height, bend into the front right knee, and then really push that back foot down to the best of your ability. Try to press the heel. Inhale here. Try to be gazing forward in front of you. It's very tempting to look down at your knee or your foot or the floor. Inhale. Exhale. Okay. So now we got the strength and then we got the length. Okay. So other things that I'm a fan of in terms of the feet that are more, you can be doing right now when you're sitting on a Zoom call. You can do it when you're sitting on the couch and watching TV. Is doing things like, I'm not going to be able to get this on camera, is doing like extending one of your legs and pressing the gas pedal and lifting up, or drawing the alphabet with your feet. Like anything we can do to be keeping that ankle and foot, mobile, drawing circles, infinity symbols, like, whatever feels good. But those are just good things to do kind of throughout your day, to be working on, moving the foot and ankle. And then those standing ones, sort of using more as like exercise snacks, that you can do throughout your day. So let's transition to upper body, to hand stuff. So the first one is going to be finger taps. So you're gonna, you can either, I happen to have a hand rest that I can rest my arm on. You can extend your arm. You can have it on your lap. So you're gonna take your thumb and your index finger, and you're gonna press them together for like 3 seconds. And you're gonna release. And then you're gonna go to the next finger, press, 3, 2, 1, and release. And then the ring finger, pressing, and release. And then lastly, pinky finger, and release. And then for good measure, we'll do the other side. All right, thumb and index finger, press, release. And middle finger, that's your middle finger, yes. And release. And now ring finger. And release. Yeah, if they're not touching, we just get as close, as we can. So maybe there's some space there, but do your best to imagine them connecting and touching, and then release. So again, something you can be doing kind of, throughout your day, things like that to, and then I usually, when I'm done with those, kind of like some wrist circles. So again, kind of back to that sort of circulation piece. So the next one, if you happen to have the tennis ball, you could use that. I even tried doing this with like a small, like balled up, like hand towel. And you don't need anything. We're just going to make a fist, but sometimes it's nice to have something to be grabbing onto. So again, if you don't have the ball or the face cloth, you're just going to imagine. So you're going to go ahead and squeeze into the tennis ball like you're trying to pop it. Like, squeeze as hard as you can for 3, 2, 1, and then release and open up. Try to extend the fingers. Once they were squeezing, they may not always want to. Maybe give them a little wiggle. We'll do it again. Squeeze for 3, 2, 1. And we'll release. And of course, we want to be balanced. So if you have the object, you'll put it in the other hand, squeezing. And you might notice it feels very different from one side to the other. Ah, rolled up pair of socks. Brilliant. Thank you, Mark. Release. Wiggle those fingers a little bit. One more time. Squeeze and release. Ah. Now, the ball, one of the things you'll see in Juliana's video is, she uses these tennis balls a lot. She uses it in the hands. So she uses it as a little like massage tool here. And then she also uses it a lot in the feet. So sitting, and then rolling the ball underneath your foot. So you'll find in her video a lot of really great tips, with a very inexpensive tool that many of us either probably have or can easily attain. So now we want to do a little stretch for the wrist. So we'll extend the arm forward, and then you're going to gently press down and try to, this is going to stretch the top of the arm. May have heard some popping. Not sure if you just heard mine. Because again, this is not a position. Our like this is not something that I think most of us ever wind up, on a daily basis with our wrist like this in our average day to day. So try to get, that nice length. You could also be again resting it on your lap. It could be again on a pillow. And then we want to do the opposite. We want to pull the fingers up and be pulling them back. So now we're stretching the bottom of that forearm. And you can hold this for 5 or 10 seconds if you have longer and it feels good. Hold it for 30 seconds. You could hold it for a minute and release. And again, often some nice little, you may be carrying lots of pops, and sometimes I think there's some Rice Krispies living in there somewhere that are talking. So hopefully that felt good. I hadn't mentioned with the calf stretch that we did that last one in that lunge position. You can hold that for 10 or 15 seconds. Folks like Rami are big fans of holding stretches like that for like 2 minutes, like really really extending that time and really letting the body lengthen. So kind of whatever works for you, feels best for you in that piece. Okay, let's go back to sharing my screen. And okay, so I'm going to pass through these because this is everything that we just did. Okay, so now some resources for folks. So specifically for folks that might be Dana-Farber patients, not sure exactly how many people there are here, but if you are a Dana-Farber patient, you are able to meet with me one-on-one for an exercise consult. They're still going on over Zoom. They used to be in person before COVID. We'll see if that comes back. But that exercise consult is completely free to you. So that contact info is there. But then, for everybody, Dana-Farber or not, we have live classes that go on over Zoom. And then we have a YouTube channel of previously recorded classes. And, I'll show you the schedule in a sec, but, a wide variety of, classes that you are able to take advantage of. So this is our weekly class schedule that we currently have. And, there are a few of these that are only in-person classes. Most of our classes are what we call hybrid, where, most of our classes are Zoom, and then a percentage of them are hybrid, where like Tuesday mornings, I'm in the Zakem Center, and then I'm also on Zoom. So I teach strength training. We have Juliana, who's the one that I showed you the video earlier. She does our chair yoga, our chair stretch and strength, our yoga flow, our core strength, our aerobics. Juliana's does lots for us. And then again, I think many of you might have met my colleague Rami, who does our Qigong, Tai Chi, and meditation classes. So, lots of things here that you can potentially avail yourself of from our classes. But I certainly know, with IWMF, you can, join Anne for classes. There's just the nice, I don't know, sort of silver lining of COVID is that a lot of these resources are now available on Zoom. And since, we learned as we started today, people are all over the country and world and, different time zones and whatnot. So, lots more options that are available. Again, back to the Dana-Farber piece, not necessarily exercise related, but we do have what we call integrative medicine consults. And these are currently being done by an oncologist who's also an acupuncturist, where she talks to you about, kind of what's going on cancer wise and what things would be recommended. She talks through supplements and things like that. We have acupuncture, we have massage, we have Reiki. So that is the contact info for folks who are available for in-person stuff at Dana-Farber. Again, I highly recommend looking into PT, OT. I feel like, there's a lot more, again, sort of focus and knowledge around this area. So hopefully you can find someone nearby to help with some of these things. And, podiatry, again, might wind up being very helpful. Maybe it's, foot inserts or other things in that vein. I listed some references and then my thank you. And hopefully I managed to leave plenty of time for questions. Okay.
Awesome, Nancy. Thank you so much. Take a breath, take some water, and I will funnel some of these questions to you that I've been writing down on the side so I can also be more aware of what you're asking for. We're going to go back to the beginning of our question list. Stephen Witt, I think you maybe touched on this with kind of pacing, energy pacing, but he wanted to talk a little bit more about how to mix the exercises with fatigue that comes along with Waldenstrom's.
Mhm.
You could maybe elaborate on that just a little bit more.
Yeah, so big fan of this sort of exercise snack concept of, sort of spacing this stuff throughout your day. So, the strength stuff and the stretching stuff is, even easier to kind of, in very short chunks be doing these things. In general, we find with the walking or biking or things like that, like we can get closer to 10 minutes from a cardio perspective to be helpful. But I have lots of people where they're starting with literally like laps around the kitchen island, or kind of making a little route throughout their house, or depending the end of their driveway in back. Like, I mean, theoretically there's no amount that is too little. So figuring out some creative little routes for yourself. But in general, I feel like for most people, if you can kind of target, if you know for yourself that the mornings are when you have more energy, trying to take advantage of that. But also knowing, that there are lots of things. I think of it like a bank account. So I think about like you have an energy bank account, and every day you wake up with a certain amount of money slash energy in your bank account. And there are going to be days where you're going to need slash want to be spending most of that time. You're meeting family and you're going out and you have an event. And so, yeah, maybe that's not the day that you decide to do the exercise. Um, that lots of things kind of pull from this account. And sometimes you don't know, some days your 10-minute walk might only, withdraw a small amount, but other days it might take a much larger chunk out of your account. So I think for a lot of people, almost keeping like a little log or a little journal, particularly if you like are on treatment, sometimes that can be helpful if there's sort of a cyclical nature to it. And if you can start to sort of see trends or know, like, yeah, I did not sleep well last night, and I did not, this thing or the other thing, or I can't remember what people were talking about in the beginning with the whiskey, but if you had too much of that whiskey tonight, then maybe tomorrow's not the day. Um, to, so kind of keeping those pieces in mind and then knowing that every little bit helps.
Perfect. Thank you so much, Nancy. And I, really enjoy the concept of energy snacks and of doing little things consistently. Like we're right in alignment, and a lot of our classes will give you those energy snacks you can do. Thanks for the question, Stephen. I'm moving on to Linda's question about pain she has while washing her hands with hand neuropathy. If you have any suggestions for pain. So, and this also kind of brings to mind another question that came a little later from Kate. The modalities you're mentioning for massage and sensory, are those applicable to those whose primary symptom is not numbness, but it's actually pain and cramping? So, kind of shifting our viewpoint towards the symptom being pain, what are you recommending? Are these things also good for that?
The research does, sort of show us that. And I think it's just a matter of adjusting, like we're talking about, massage, how much pressure you might be using for this. So it might be really gentle, sort of touch there as opposed to really, again, maybe then you don't want the spiky ball because that's not going to feel great. But maybe, the tennis ball or the pinky ball, that again, you can gently, like I think in the video, Julian is like leaning over and pressing on the ball. That's probably going to be too much. Can you have the ball on the counter and do, some really gentle moves? Bambi talks a lot through kind of some gentle massage of the hand and the fingers. So just, keeping that more, and adjusting the pressure. Because, yeah, we don't want you to have more pain after trying to do something to alleviate your pain. So,
Got you. And just to tag on Susan's question that just came in about are these exercises actually stimulating healing of damaged nerves as opposed to just making you feel better? Great question.
I think, some of that we're still sort of trying to figure out sort of how, like, I think a lot of this is still somewhat a mystery. Like, why is the message getting lost between the brain and, the extremity? What's going awry there? How do we again, partly depending on what was the cause, of neuropathy, but even as we sort of step back a little bit broader, when we think about something like your muscle, a lot of times when we think about our muscle, we think it's there, like it's helpful. It helps us be able to pick up the laundry basket or, do, activities that we enjoy throughout our day. But we just think like it's just this thing, like it's just muscle, it's just there. But in reality, your muscle is actually what we refer to as an endocrine organ, which means it is secreting things. It's not just this lump in your body. It's actually secreting things, just like our fat. We used to think our fat cells were just fat cells. Well, actually, they secrete things. So, one of the things that muscles secrete are these things called myokines. And, we're not going to turn this into like a anatomy lesson or chemistry lesson but this concept like is new. Like we're like just appreciating this in the exercise physiology world and other worlds. They're like, oh, muscles are actually doing things and secreting things. And so specifically, one of the myokines that muscles secrete is this thing called irisin. And we have like an entire group at Dana-Farber that studies irisin, that has sort of wide ranging, benefits and effects, but one of which is sort of nerves. And so there's been some interesting research, again, more in like the diabetic neuropathy and seeing that the muscles are secreting this stuff that is helping to deal with some of these symptoms. So again, this is where I feel like in 2 years, I mean, now that we've like identified this, and we can study it more, there's a lot more sort of avenues to pursue here. So I feel like kind of fingers crossed for more discoveries.
Gotcha. Wonderful. Thank you for piquing our interest about some new things that are being studied that could be helpful. And yeah, there's a lot that's just unknown, and clearly we need more research. And those of us in the Waldenstrom's world often lament the fact that the research is not directly this specialty population because we're very different. But as close as we can get, we'll take it, right? So thank you for sharing what you're doing there. I think I want to switch it up to Margaret's question about what you consider aerobic exercise. So she's asking, is swimming, crawl, and breaststroke aerobic exercise?
Absolutely. I mean, I feel like sort of anything that gets your, muscles moving, your heart rate going. I mean, used to always have the sort of debate with my father whether, golfing counted as exercise. And I was like, well, if you've got the cart and you're sort of barely walking from like the cart to the green or whatever, like, sorry, Dad, but like if you're carrying your clubs or walking. But yeah, I mean, absolutely the pool certainly laps. For sure, walking, biking, dancing, like that it doesn't need to be this more structured thing or somewhere that you have to go to or like pool or something. Literally turn on your favorite song and just move around. Like really sort of lowering the bar for like what counts, because again we talked about the enjoyment piece. So if you're going to enjoy dancing around your living room, then that's what I want you to do.
Nancy, we can definitely be friends if you're gonna turn on music and dance. You're definitely speaking. Okay, well,
Well, as long as it's not Zumba, as long as you're not requiring me to be very coordinated with it.
just moving the body. I love it. And I'm also just inspired by Margaret's question to share a motivational piece that I just watched, Naiad, last night, which is an incredible movie about Diane Naiad, who at age 62 or something swam from Florida to Cuba. Oh, incredible. Anyway, just an aside, Margaret, keep up the good swimming. It sounds like you're doing. I want to move to Dottie Hermeling's question about what helps, especially if you only have PN symptoms at night. Good question.
And it might be that, that's when you try to do some of those stretches or moves. Cause yeah, especially if it's like you've laid down in bed, to go to bed, you're not going to want to stand up and like do some wall squats or do some calf raises. You're in bed. So maybe it is some of those, particularly if it's your feet, ankle rolls, starting to draw um, the alphabet, again, the finger things, gripping things. But yeah, it's hard, particularly if it's like as you're trying to fall asleep. And you'll even find in our neuropathy toolkit that there's sort of a guided meditation that's sort of geared towards some of that, sort of helping you when there's pain and you're trying to sleep. Those things don't often go well together. So giving you some tips and tricks in that vein.
Perfect. Great answer. Thank you so much. And a lot of our other friends talk about this problem too, being awake at night due to pain, and this is the time when they experience it. And so, yeah, turning to those resources that are maybe working with the mind, as a way to address what you're experiencing. Moving on to Elsa's question, what do we know about hip replacement when dealing with peripheral neuropathy?
I don't have an answer for that. Yeah. Hmm.
We can get follow up and resources and come back to that one. It's an interesting question. Um, Somebody is asking, Linda is asking, do you have an emollient recommendation for cracks at the end of your fingers? A little out.
Because
Off.
I was trying to think of it when I was mentioning it, and now, of course, it's like I can picture it, but I can't get the words. I'm sure somebody in here must have a suggestion that they can put into the chat. Um, but I mean, like the Eucerin, like I'm trying to think of some of the other brands that are. and particularly or like even the Neutrogena, like the thicker, like you don't want the like kind of watery, really thin lotions. I mean, for some people, like Vaseline, like, this doesn't mean you need to go buy some fancy, expensive product somewhere. Things as relatively expensive as Vaseline um, can, for some folks, be really helpful.
Yeah, and we've got some things coming into the chat, and we can certainly address that later as well, separately. So let's see, Ken is asking, have you noticed whether peripheral neuropathy tends to cause or make worse any other foot issue?
I feel like it could make you more predisposed to even like a bunion, if you can't feel your feet. So then you're not, like proper biomechanics, landing on your heel, rolling through your arch, pushing off your big toe. So I, sort of briefly mentioned the big toe piece. So, your big toe is big for a reason. It's not like some random thing that just happened. And when we were done, someone's like, oh, just make that one toe really big. There's a reason it's big. And that is like a big part of your ability to walk quickly. And most of us, unfortunately, as we age, we lose that ability to press off that toe and to flex and have that full range of motion in our toe. And then, things like bunions can happen, neuromas. I mean, there's again, like I worked briefly for a podiatrist. Yeah, I mean, fortunately, lots of other foot things. And again, it's not like, oh my God, this is going to happen to me. I don't want there to be like this fear that these things are going to happen, but sort of more reasons to really try to work on your foot, sort of mechanics. Even if it's like literally just you taking your big toe and, stretching it and gently moving it, spreading your toes out, things like that to just help keep your foot in particular very sort of mobile.
Got it. Thank you so much. A question coming in, let's see here, from Francine. And I actually had this question too, because I love my Birkenstocks. Why is it not recommended to wear sandals? She feels better with open toes.
Right. And that's, these are the recommended, like that list that I went through there, like this is stuff that you just find. If you Google, go to doctors, like those are the sort of blanket recommendations that they give. Open toe, the problem is if you can't feel your toes and they're exposed, you could wind up, cutting them, banging them into something. I mean, again, if it's something big enough, even a shoe's not gonna help. But um, and so that's where, I also want to kind of marry like finding something that's comfortable. If literally all you can wear is Birkenstocks, then it's like, I'm going to tell you to not, but then being extra diligent and mindful of checking your feet. And then ideally having something that, depending on the Birkenstock, that like has, some heel support that's not just, again, like kind of more like a flip flop, like a really open and it's, also just going to depend on your particular symptomology. The numbness versus the tingling, potentially a little bit worse if it's that, you're really numb, then you're potentially not going to notice that you jammed your foot into something. So,
Yeah, it sounds pretty common sense to me. And Francine, we're gonna have a party where we can both dance and wear open-toed shoes together. I had a couple questions coming in from Lisa, and she's asking, do these peripheral neuropathy tips apply to CIDP, which chronic inflammatory demyelinating polyneuropathy? Would these things that we're talking about today apply to that? And I don't know enough about that to be able to make any. That's
yeah,
what I need to know.
nor do I. I would sort of think that I wouldn't think they were going to hurt, but I couldn't answer specifically.
Right. And would you say that the leg cramps she experiences and the tingling at night would be considered part of PN, peripheral neuropathy?
I would leave that up to a doctor to sort of determine that piece because there's a lot of kind of overlap and gray areas in there that make it
Gotcha.
tough.
I love what, let's see, where did he go? Chad was talking about using a hot tub. He loves getting in the hot tub for his arm and hand neuropathy. Is that okay to use? He uses it in the morning and before bed, and if he can't sleep at 3 a.m., he's popping into the hot tub and getting a little pain relief.
Well, that sounds lovely. So I'm always looking for something at 3 a.m. to do. I'm like, might be onto something. Um, Again, I think you have to be smart about it and make sure that the temperature isn't, so if there's someone else with you that can confirm, or how, I don't know how this hot tub works, and does, is there a temperature gauge to it, to just make sure that, you're not going to wind up scalding yourself. I mean, I wouldn't think that a hot tub, but it's slightly out of my realm of expertise, but if it gives you relief.
Gotcha. All right, friends. So we're going to keep any other questions coming in. We're drawing to a close. Holly, I see your question about getting the lymph system moving, and I feel like it's a little off our topic, but I really do want to have a whole webinar about immune system function and moving the lymph. And believe me, it's on my list. Unless Nancy, Nancy, if you wanted to comment about that, feel free to do that.
Yeah, I mean, agreed. A lot of sort of similarities and overlaps with the lymphatic system. And, what's interesting with the lymphatic system, if we contrast it to the cardiovascular system. So your heart, its job is to help move and pump the blood throughout your body. And so the heart beats and the fluid moves, blood moves. Well, your lymphatic system like doesn't have a heart. It doesn't have lungs. It doesn't have something that moves the fluid. You know what moves the fluid? You move the fluid. Or more specifically, your muscles move the fluid. So when we think about like swelling in our feet and ankles, walking, doing those, heel pumps, things like that help pump literally and move that fluid throughout your body. So definitely some similarities. So the things like the calf raises and the calf stretch and the, you know, doing the aerobic exercise, all of those things help move, your lymph throughout your body. So
Gotcha. I'm not seeing any other questions. If I missed your question, please feel free to retype it. I tried my best. Some of them weren't questions, but more statements. But I do want to just give you a little bit of information too about resources that we have through the IWMF's wellness program. We have a lot of the same things. We looked at everything that Zakhem is doing, and we were like, well, we could do that too. So now we actually have Rami. He's going to be doing a monthly class with us. So
what?
exciting. And that's February 6th. We start with Rami, and that's the Tai Chi Qigong. He's so excellent. And in our follow-up e-blast with the recording, you'll receive a recording of this. You'll also receive everything that Nancy talked about today, and then other resources that IWMF has, including tomorrow I'm going to be doing a cardio flow class. So we're going to get the heart pumping, get the circulation moving, and you can bet we're going to be doing some calf raises in that and some balance work as well, thanks to Nancy. And let's see here. We covered the resources. Is there anything else you would like to share with us, Nancy, that you've seen in terms of motivation for people, how to keep going with this debilitating condition, and how to reach out and help? Let's see. Chad has one more question here. He says he's 52, which is young for Waldenstrom's, has just been diagnosed, and he's had 2 chemo treatments done. Congratulations, 4 left. Will the peripheral neuropathy maybe lighten or stay the same as his treatments continue? I don't think that's a question we can answer, but maybe you have some anecdotal evidence you can share, Nancy, with how the peripheral neuropathy and the treatment go together.
Yeah, I mean, certainly if treatment is making things worse, like if we're getting more CIPN than the actual PN piece, then, hopefully those symptoms would, potentially get better. But I think one of the best features here is how, you all have each other as you're the resources and the experts here, and, sort of keeping, the lines of communication open, and the, suggestions and tips and ideas. And because especially it is, a growing and evolving field. So hopefully, over time there will be even more resources available.
Gotcha. All right. Well, thank you so, so much, Nancy. We're so thrilled to have been graced with your presence a second time. And it was really interesting to hear how things had changed or not changed within the span of 2 years since we last met with you. Our next wellness webinar is going to be on February 29th, and we're going to be talking about osteoporosis. We're going to be talking about strengthening bones through yoga. And so I'll include that resource in our follow-up email as well. You can sign up for that right away. And our presenter will be me. Actually, I've been certified to teach yoga for osteoporosis. And there's some good research out there that supports utilizing yoga poses for increasing bone density. So beyond that, we'll have some other our monthly webinars will continue. And we are just so thrilled to have you here today, Nancy. I'm going to ask that we momentarily shut the recording off. And if there are any other questions that folks didn't want to be, highlighted in a recording, we can leave some time for that. But thank you so much. We appreciate it.
My pleasure. Thank you all for carving out some time to spend with me today. I greatly appreciate it.